Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Adrienne Boissy. She's Chief Medical Officer at Qualtrics. Welcome, Adrienne.
Thanks for having me, John. So excited to be here.
Yeah, me too. Colin's had you on the show a lot of times, so I'm glad I finally get the chance to have you here. But before we dive into kind of the topic du jour and our experience at X4, tell us a little bit about yourself and Qualtrics.
Sure. Well, hi, I'm Adrienne Boissy. I am a practicing neurologist. I take care primarily of multiple sclerosis patients at the Cleveland Clinic. Been there about 23 years, former chief experience officer there for about 7. Um, Much more fun facts. I got a master's in ethics because I was constantly curious about why we do what we do to humans. And I can dance every role in the Nutcracker as a ballerina on demand.
Wow, I didn't know that. You're a ballerina. That's awesome.
Well, washed up. And I came to Qualtrics really because my passion in life is about reducing suffering and creating joy. And I wanted to be a part of a company that was driving better experiences for brands all over the world.
Wow, that's amazing. I mean, I think there's a reason we affectionately call you the empathy queen because you care so much, and so I guess it makes sense why you're at Qualtrics. So you get all the data to be able to care better. I think that's beautiful. We both went to the X4 conference, this kind of Qualtrics user conference, if you will. What's your main takeaway talking with your healthcare customers at X4?
The big one for me was actually about hunger. There was such an appetite and a little bit of a fervor and energy around people ready to do experience differently, right? We've been measuring for so long only a certain segment of the population. And you're hearing, not just hearing, you're seeing stories come to life of organizations doing it differently, pushing a bit further, listening a bit more. And I think that's what struck me the most was we're at a tipping point. We are here. The big innovators have moved. Many others are in contemplative stage or ready to change. And I think there's laggards who are really comfortable with continuing to use paper reports to talk about their inpatient surveys delivered by paper. And the future looks a lot different. And I think we heard that loud and clear at X4.
Hmm. Fact survives in healthcare, paper survives in healthcare, but it shouldn't. That's what I just heard you say.
It's well, it is unbelievable. I mean, I still have a mailbox in my office and I still get faxes that can only be returned by fax. And and yet we're really expecting extraordinary results from clinicians who are partially equipped, I would say, to deliver them because they're still checking their faxes and they're still checking their beepers.
Well, yeah, I
And
mean, and you think about a survey that's on paper, like the throughput time just to get the results, let alone to get the results from the patient, assuming they even do it. I don't even check my mailbox, it's all junk mail. But assuming they do it, then you actually get it to the people who can actually do something. Like that's just it's shameful that we even do it. Let's be frank. Right?
I think we do need to look ourselves in the mirror. And it sometimes I'm viewed, to be quite honest, as being a little bit, what is it, a rebel with the cause, I hope, because I'm willing to say out loud that a 21% national CMS paper return rate for HCAPs is really unacceptable as a listening strategy today in healthcare. And although many organizations continue to put their rankings, all rankings are built off HCAPS, and that's the only source of data. And so as long as we continue to aspire, the boards continue to aspire to US News World Report or Vizient rankings in that way, I think I'm much more excited about expanding beyond that. And we heard people who were ready to do that at X4 and who are doing it, not only getting better at HCAPS, doing what we need to do, but also dreaming and moving and expanding listening, going from 2 languages to 7 at Stanford, or a 300% increase in response rate at Community Health Network. Like, people are doing it. And it was so exciting. Do you remember the slide University of Utah put up around listening with their legacy vendor with the little tiny orange dot, and then listening now? It's just expansive. I'll share it with you. It was really remarkable. And that gets me so excited
Yeah.
about really listening, and not just to patients, to our employees as well. You know, for being honest with ourselves, we're still often in an annual engagement survey.
Yeah. Well, and we have to do the HCAPs. Like that, that's an important part of what they have to do. But what are some of the other creative ways that you heard customers were using Qualtrics to listen to the patients and even drive behaviors? And I'll throw my two in and we'll see if I steal yours. One was you can insert the customer because I can't remember their name, but they use the surveys to drive use of their Epic My chart. I thought that was super fascinating. So at the end of the survey, they essentially incorporate a question that says, "Are you a MyChart user?" And they already knew it. They incorporated it in the survey depending on what they already knew, and they said you should go use it. And so after they fill out the survey, they would drive the traffic there. I thought that was unique. And the other one was the HCAP score, and using the data from surveys of patients to predict what the HCAP scores were going to be 3 months or 6 months, I forget how long, when they actually got the results, but they were able to correlate it with existing data so they could do some real-time efforts to improve those. Those were too fascinating for me. Anyway, what were yours?
Yeah, those are great. I think you're talking about, at least in the first example, Community Health Network, when
Yeah.
Maggie Gentry was talking about ROI and highlighting, I think they drove almost 10,000 activated patients to use the MyChart portal. In addition, they did the same around access and appointments, right? By proactive outreach. Hey, you haven't been in a while. I think it was over 18 months if you hadn't come in. They did proactive outreach through the platform and activated, I think, 12% of those then transitioned to a new patient appointment. Like, this is a great use case around
Sure.
access.
And
Uh,
meaningful engagement, and that's helpful to patients.
I thought the Mayo Clinic did a great job. Really struck me around Lori's presentation around using unstructured data analytics in the Qualtrics platform to assess your performance to living your values as an organization.
Hmm.
That was really incredible, because isn't that what your culture is about? How congruent the patient and employee experience is when they're talking about how you show up every day to live your values or not. I thought that was brilliant. And then she also had this oh no dashboard that she had flexibly created in the platform for topics that weren't quite sure what to do with or needed to get addressed, but didn't fall into sort of a classic category. I thought that was a beautiful way of capturing, listening to signals and managing it effectively. Another one that really popped for me was maybe Mainstage, even when Brad Anderson was talking about some of the AI capability, this notion of having a conversation with your data, not even just sort of expecting it to be ready or real time, but being able to pose good questions about the data that you have as an experienced organization, as a manager or as a leader, and say, help that inform from all other peer-reviewed best practices or evidence out there or other industries. How should I manage this segment of my population or feedback that I'm getting in a most effective way? This is the future, is having conversations with your data that are powered by thoughtful AI.
Yeah. Well, I mean, you talk about that as the future is seeing the data, right? Do you think healthcare is waking up to the voice of the patient? Like, I would argue that for a lot of organizations, not all of them, we kind of took the patient for granted. Because, when you got a 6 month wait list, you can, right? Like, let's be frank, right? But, what do you see happening today as far as, empathy for the patient?
Well, I think we're still, I would say, teetering a bit. I see a lot of progress forward. I certainly see verbiage and values around focusing on patient-centeredness and quality efforts and access. We're still careful about using the word empathy and love as other customer obsessed industries do, right? They are
Yeah.
customer obsessed. I think I would challenge us as to whether or not we really think we're patient obsessed. Because if we were patient obsessed, access of 84 days for a new patient appointment would probably be unacceptable. And we would be rushing to fix it. And instead, we're not. There are annual reports that continue to tell us that patient waits are getting longer. And so
That's fascinating.
something isn't quite moving at a pace I think we can move, although I see great progress in pockets. Another maybe good example of that is in every other customer obsessed industry, they value service recovery. In healthcare, I would submit to all of us that we are afraid to some extent of service recovery at scale, right? So within the Qualtrics platform, you can power service recovery at scale by timestamp ticketing, routing to the right people, managing those lists, bubbling up and escalating, all of that. And although Verizon has a goal of 100% of customer issues or concerns will be addressed, we sometimes leave those out, dangling, hoping that next time it will be better. And I think organizations like Christus Health or Community Health or Stanford are beginning to say, no, no, no. When we hear about an issue, we're going to follow up and resolve it. And to me, this is a fundamental commitment to the patient. It's a fundamental commitment to our employees that I want us to be braver about. I want us to be courageous and say, you're right. When there's issues, we will resolve in a timely fashion. We can commit to that. That is part of patient-centeredness as they originally conceived of it 20 some odd years ago.
I mean, what's interesting is I don't think I'd heard the term service recovery until about a month ago. And I've heard it a couple times now in this last month, which does feel like in my mind is a little bit of a shift. So like for people that don't even know what service recovery is, how would you describe it? What does that look like in healthcare?
Well, let's describe what it's supposed to look like in
Okay. What could it look like?
maybe that's a better place to start. I mean, the example I always give is if you go shopping for people who know me know this example. If you go shopping for paper towels at Target, let's say, and you walk into the store, you know the price of the paper towel, you know what aisle it's in, and you can put it in your cart and go buy it, and you are fully clothed and in control of your shopping experience. If you're a patient, you are lacking choice around a lot of those things. So let's say I've gone and I put the paper towels in my grocery cart, and some other customer walks up, grabs it out of my cart, and pushes my cart over. If a Target employee rushes over to me and says, sorry about that, and walks away, I am likely never coming back to Target, right? They were different to my concern. They didn't help me resolve the issue. And I felt invisible from a service and an experience standpoint. I'm lucky I got I'm sorry, but it certainly wasn't authentic. If a Target employee comes over and says, oh my gosh, I am so sorry, I saw what just happened. I'm going to make sure you get a full arsenal of paper towels. I'm going to give you 3 extra ones, and let's go to the register. I'll walk over there with you and make sure that we get those taken care of. They're on us. Don't you worry. And is your leg okay? I saw the cart tip over. I'm just really so sorry. That is not a standard of behavior we tolerate here at Target. Thank you so much for trusting us with buying your paper towel needs.
Yeah.
Like, I'm in love with, all of a sudden you just reinforced my love for your brand. And the idea is that my likelihood to return to Target with an okay service recovery experience is 50-50. If there's no service recovery, it's much less. And if I do a beautiful job at service recovery, I'm coming back. I'm going to tell all my friends that story for the next 5 years, right? And so it has tremendous ripple effect. And with all this talk about likelihood to recommend and NPS and earned growth rate from recommendations, this is a really important concept that I think healthcare is a bit slower to grab onto. And so in healthcare, right, we hear surveys every day. There's no lack of data, but it's dark data. And it's also dark data, not only because we're not very good at analyzing unstructured data, but we're not very good at analyzing emotion and intensity of that emotion. And today, Qualtrics can do that for you. And so if we understood that somebody had a highly intensely emotional experience that was poor, then my gosh, we should prioritize that for outreach, right? And maybe human outreach, not human avatar outreach. Maybe that could do the less intense. But we can help you do that. And guess what? It's incredibly rewarding when I feel heard, seen, and valued as a customer, especially as a patient when I'm also afraid and vulnerable. And it makes our employees feel pretty great too. But
Yeah.
we seem to shy away from it still, I think, as a thing we're going to put a stake in the ground about. And I would argue it's an easy place to start.
Hmm. It's hard to be humble enough to do that, but it is powerful. I mean, I think it's Alba from Stanford Health. I think we did a video together. You can check it out at healthcareittoday.com. But like she talked about doing that, the service recovery. There was a problem reported. They addressed it and sent the message to the patient, and they got it in the parking lot before they left.
That's
And the person was like, "Wait, I didn't know you were listening."
right.
like,
Because
like,
it's almost become the norm that the
yeah,
expectation is you'll complete a survey and no one will follow
yeah.
up,
I
right?
complained, but at least it was cathartic because I complained, but no one's going to do anything.
Well, you didn't expect to hear anything back. And yet it's really interesting, I think, when you look at evidence-based best practices to drive improvement, for example, in our ERs, one of the most evidence-based best practices is a callback program, right? You go home from the ER, somebody calls you the next day, even better if it's the person who took care of you to say, hey, I was thinking about you since you left. Are you okay? Do you have what you know? I mean, well, again, the basic expectation is that we won't exceed expectations from a service standpoint. In fact, we hardly meet them. Think about what organizations can do when we create a little more joy, when we unexpectedly exceed. This, I think, is some of the beauty of what I'm seeing organizations do, many of which you described.
Nice. The other big one, I think this year was kind of the Epic partnership, having them on stage talking about it. Tell us what's happening today with Epic and Qualtrics and kind of what are you working on for the future? It seemed like there was like a 2 or 3 stage process of integration and opportunity.
Well, I think we're in it together for the long haul. I think, as you know, when Epic started, they were an electronic medical record with the idea that it was clinical data and management of that. And I think there's a shared desire to really make sure we are honoring the experience that people actually have as they move through healthcare, and that Qualtrics can do an amazing job at helping Epic visualize that journey either by segment or ultimately individual to understand more. How can we say something that's actually meaningful? How can I remember the last time you were here, we gave you the wrong taco instead of fish? That provides memory, which is incredibly important to making people feel valued and seen, right? I trust this place because they remember what's important to me. And so I think that's sort of a long-term shared goal that we have. In the shorter term, there's a commitment around service recovery. So making sure that we can inform and provide insights into Epic so that it can power insights and service recovery, either through their Cheers platform or other platforms, other modules of Epic. We also want to think about connecting individual emotional data across the continuum so that people don't feel the fragmentation that often exists in our systems. And there's a lot of foundational work around that. We're also tightly linked around social determinants and making sure that almost that we could extract social determinant data from unstructured data and
Hmm.
inform so that we don't have to send out surveys that people don't fill. We should really understand this from what they've already said. And the uniqueness, as you know, of the Qualtrics platform is it can ingest over 150 different sources of data, whether that's MyChart messages or phone calls or faxes or letters to complaints and grievances, which really help power the type of human experience I think we all want.
Yeah. One, I think is what's powerful I notice is that providers live in their EHR, at least for today. We'll see if ambient voice adjust that. But anyway, for today, if it's not there, they're not going to see it, right? And the survey data wasn't there. It was separate. And so I think this is an interesting step into giving them a view into what the patient's experiencing.
Yeah, well, I'm gonna +1 you and +2 you in the sense of imagine when I mean, there are so many tabs across the top and the side that click into multiple other tabs. And I think someone posted today that there's 14 clicks to order aspirin or ibuprofen. There's still opportunity to ease that. And I know they're working hard on that and we're working hard on that because ease is a fundamental concept. It still feels too hard for both the clinician and the patient to do what they want to do in healthcare. And so I would +1 you to say, imagine that when I open the electronic health record, confetti sprays out and I'm told or given some gratitude from patients for me over time.
Mm,
This is part of the work to be done with Epic, is to make sure we can creatively capture patient insights and really love that we want to shower a little creatively on clinicians. And we got to hit the brain in creative ways, right? Because otherwise it's just clicking. It's clicking, 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 clicking,
You're just a
clicking.
machine.
And we can sort of pop some joy up for people who I think are in incredible need and leverage patient love to do that. Another opportunity I think is really around um, putting insights at my fingertips. What if I opened it up and I remembered, or there was a note that popped up and said, hey, last time you really spent a lot of time talking about the recent passing of their mom. Check in on that before you dive into whether or not they've been taking their Ocrevus.
Sure.
I, it's not telling me what to do, right? But it's
Right.
putting some information at my fingertips that as a healer and a physician might make me a more effective human and certainly a doctor. And that is meaningful to me.
Yeah, for sure. Well, I want to wrap up with this, quickly with what I call the magic wand question is if you could change one thing in healthcare with a snap of your fingers, what would you change?
I'm stealing two snaps.
Okay.
One is absolutely no clicks.
Mm,
I have clicking a lot,
okay.
and it erodes my own joy in having real conversations with people that I care about, that
Yeah.
I've been caring for 23 years. And it's in the way. So I want it out of the way. The second one is love. I want us to get back to talking about love, feeling loved, loving on our patients. And that may be a word that we're not comfortable using today, but I hope and will spend the rest of my life trying to get us in a place where love is a part of how we provide healthcare, and it's fundamental, non-negotiable, not
Wow.
soft and fluffy. It's just how we do it.
That's why we love you, Adrienne. So thanks so much for taking time to talk about this. It was a great experience at X4, and it's nice to be able to share these stories with our audience. And so thank you so much. And thank you everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Adrienne.
Thanks, John. What a pleasure.